I'm Dr. Niranjana. I'm a consultant infertility specialist and laparoscopic surgeon at KJK Hospital, Trivandrum. Now, IVF is a very complex procedure. It is usually done by couples who have had other forms of treatment not working out for them. Say, for example, a couple has tried around 4 or 6 cycles of IUI and it did not work, then they would probably be going in for an IVF next. But the important thing to remember here is that IVF is not a 100% sure guaranteed procedure. Like all procedures, it carries its own success rate. Now, what happens is that majority of the times, the patients are so sure that doing an IVF gives them a baby. When it becomes negative, they get very depressed. So the success rate worldwide is around 42 to 45%, and the maximum success rate that you get is around 48%. So for advertisement basis, we can say that our center gives you around 85 or 90% success rate. But the truth is that even worldwide, the standard success rate is around 45%. Then again, there is nothing that should hinder you from becoming pregnant in your first cycle. But realistically speaking, if 100 couples do the procedure, around 45 couples will become pregnant and the remaining will not. So we won't be able to find out the reason why a certain number of people become pregnant and a certain number don't. The only reason that we can possibly attribute to that is that it's an implantation failure. But then again, you should not lose hope. There are couples who have done the procedure 6 and 7 times and who have had a good outcome at the 7th time. Now, success of IVF depends on a lot of things. Like everything, it depends on a lot of factors. The age of the couple undergoing the procedure, the ovarian reserve of the wife, what is the indication for the couple undergoing IVF, how is the lab condition. A lot of factors play in getting a positive success rate in IVF. So if you have made up your mind that you're planning to go for an IVF, then you should go for the procedure without much delay. As the wife's age becomes more, that is, if the wife's age is more than 35, the success rate of IVF decreases. For an age more than 35, you have a success rate of around 30 to 35%. For a younger age couple, you get a success rate of around 42 to 45%. And one of the most important things that you should remember is that IVF is a very stressful procedure because you're investing a lot of time and money and energy into this. You should just make sure that you are not affected financially or emotionally by the stress. And the last and the most important thing is that do not give up hope. If this is not the end of the road, if this doesn't work, there is always a next step. So not losing hope and keeping a positive frame of mind is very important when you're undergoing an IVF procedure.